Coronaviruses are a wide range of viruses that may cause disease in animals and humans. It is known that a number of coronaviruses in humans cause respiratory diseases, the severity of which ranges from common colds to more severe diseases such as the Middle East Respiratory Syndrome (MERS) and severe acute respiratory syndrome (SARS). The newly discovered coronavirus causes COVID-19 disease. What is COVID-19 disease? COVID-19 disease is an infectious disease caused by the last detected virus of the coronavirus. There was no knowledge of this new virus and its disease before it began spreading in Wuhan, China, in December 2019. COVID-19 has now turned into a pandemic affecting many countries of the world. What are the symptoms of COVID-19 disease? The most common symptoms of COVID-19 disease are fever, dry cough and fatigue. Some patients may experience pain and aches, nasal congestion, throat pain, or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but only very mild symptoms appear. Most people, about 80%, recover from the disease without need to hospital treatment. And the severity of the disease intensifies in approximately 1 person out of every 5 people who develop COVID-19 infection, who suffer from difficulty breathing. The risk of serious complications rises among the elderly, and people who already have medical problems, such as high blood pressure or heart and lung disease, diabetes or cancer. But anyone can develop a COVID-19 infection with severe symptoms. Even people with very mild COVID-19 symptoms can pass the virus on to others. All people with fever, cough and difficulty breathing should seek medical attention, regardless of age. What do I do if I have COVID-19 symptoms and when should I seek medical attention? If your symptoms are mild, such as a slight cough or a slight fever, there is generally no need to seek medical attention. Stay home, isolate yourself and monitor your symptoms. And follow the national guidelines for self-isolation. But if you live in an area where malaria or dengue fever is common, you should not ignore the symptoms of fever. Seek medical help. When you go to the healthcare facility, put a muzzle if possible, keep at least 1 meter, 3 feet between you and others, and avoid touching the surfaces around your hands. If the patient is a child, help them adhere to these tips. Seek medical attention right away if you experience difficulty breathing or chest pain, pressure. Call your doctor in advance, if possible, so that they can guide you to the appropriate health facility. How is COVID-19 disease spread? People can catch COVID-19 infection from other people who have the virus. The disease is spread mainly from person to person through small droplets secreted by a person with COVID-19 from his nose or mouth when he coughs, sneezes or speaks. These droplets are relatively heavy in weight, as they do not travel to a remote location but rather fall quickly to the ground. People can catch COVID-19 disease if they breathe these droplets from someone who has the virus. Therefore it is important to keep at least 1 meter, 3 feet from others. These droplets may land on objects and surfaces surrounding the person, such as tables, door handles, and stair handrails. People can then become infected when they touch these objects or surfaces and then touch their eyes, nose, or mouth. Therefore, it is important to wash regularly the washing of hands with soap and water, or to clean them with an alcohol disinfectant to rub the hands. How to properly wear the muzzle. If you decide to wear a muzzle, follow the instructions below. 1. Before touching the muzzle, clean your hands by rubbing them with an alcohol cleanser or by washing them with soap and water. 2. Check the muzzle and make sure it is free from cracks and holes. 3. Select the top end of the muzzle, the position of the metal strip. 4. Make sure to point the correct side of the muzzle out, the colored side. 5. Place the muzzle on your face. Press the metallic tape or the hardened tip of the muzzle to shape your nose. 6. Pull the bottom of the muzzle to cover your mouth and chin. 7. Do not touch the muzzle as long as you wear it for protection. 8. After use, take off the muzzle by removing the rubber band from behind the ears, taking care to keep it away from your face and clothing to avoid coming into contact with potentially contaminated muzzle parts. 9. Dispose of used muzzle immediately by throwing it in a closed waste bin. Do not use the used muzzle again. 10. Clean your hands after touching or throwing the muzzle, either by rubbing them with an alcohol cleanser or by washing them with soap and water if they are clearly dirty.